I quickly want to talk about the brain drain situation in the health sector of Nigeria, and I'm going to do this from a doctor's perspective. I'm going to say a few things about the nurses, if it comes up in one or two ways, but I'm not in the profession, so I cannot say much. But we are very certain that these are another group of people that are living like there is no tomorrow. And I'm going to try to take this video through stages so that we can be able to understand and connect with the video. I really don't think people understand how bad it is. Because if we really understand, when doctors were fighting tooth and nail with the federal government for hazard allowance, I believe the rest of Nigeria should have put their mouth into that conversation if we really understand how bad the situation is. Because anything that the country should do to encourage doctors is what they should be doing at this time. But yet they are not doing it, and people will continue to go. You may think it's really none of your business whether or not health professionals are leaving. Maybe you have the money to fly yourself abroad for checkup, but one day you will have an emergency and somebody will need to attend to you instantly, and you see that is not a time to start lifting air ambulance. You may just die. You could just have ulcer, and then one day the thing becomes perforated and you will need to get an emergency procedure done. And these are the issues. One day it will get really bad. At least I know that at the moment, some centers you go to in Nigeria, everybody is deliberately cutting down elective cases, like cases that you get to decide when you are going to do, and they are taking only emergencies. They are cutting down elective cases, taking emergencies, and time will come, if care is not taken, even the emergencies will not have hands that will be able to deliver and get it done. So this thing is everybody's business, and even the citizens do not even make it easy or bearable for the doctors to stay here. It's my 7th month as a house officer, and I can tell you for free that I've escaped being beaten by patients' relatives about 2 or 3 times. I can't go into the details of what happened, but one thing I know about myself is I'm a person that is very committed to our work. You will find me at my duty post when you're supposed to find me. When it's time for me to go, I will still go. And sometimes if I even need to stay an extra time to get something done, because at the end of the day, we are handling lives and we need to take care of these things. There needs to be some certain level of empathy. I will do it. And yet, this patient's relative keep looking for who to beat up. The night I escaped being beaten by a patient's relative, the nurse I was on duty with that night was beaten. I only even came out later and found out that they were actually even looking for the doctor that was on call. And I was the person that was there when everything was happening. And somehow the nurse just got in the middle and he was the person that was beaten. Me, I sensed the environment was getting tense early enough, and so I left. And numerous other experiences. I have a classmate from the university who was also beaten by a patient's relative, and he had to wear a neck collar for a while. And the last time I was discussing with him about it, he said he's still having some of the side effects from what happened. How is a person like him supposed to see an opportunity for him to leave this country and he will not jump into that offer? Because citizens even keep making it just really difficult. Encourage us to stay. Encourage us to stay. And it's not even only for federal government to encourage us to stay, or state government or whatever. You, the citizens, make our work easy. They will tell you what to do. You will decide to just do something else entirely and end up complicating the situation. Or you pick fights and quarrels with your doctors. It's not fair. And one day it will come knocking at your door. I've said it already that some centers are gradually cutting down on the number of elective procedures they can take, but they are still taking emergencies. And time will come when they will also begin to cut down on some of the emergency surgeries, because there will be no hands. The way that everybody is living, I promise you one day there will really be no hands to get these things done, if the situation is not looked into and aborted early enough. I can tell you for free that most people that are house officers at the moment, maybe about 40% of them should have written the International English Licensing Test. And they're preparing to book PLAB or write USMLE. Some people have going to Saudi Arabia in mind. Nobody wants to stay. There is nothing that encourages you to stay. And if you're the type of person that has mentors, you have people you look up to, people you listen to, you talk to those people and they'll even tell you, when do you intend to go? When do you plan to leave the country? Because those ones have seen shege. Just that maybe they have come to a point they feel like, okay, maybe I'm a professor, I'm fairly established in this profession, it will be difficult for me to start my life all over again, so let me just stay. But they don't encourage the young ones to stay. Any one of them you talk to, they will tell you leave. As it is now, even people that are consultants are moving over to Saudi Arabia. Some people will retire as consultants and they'll go to Saudi Arabia, because at the end of the day, it's this money that everybody is chasing to an extent. Nobody wants to stay here. I've said that house officers are preparing to. These are the people at the entry point of the profession. And like we always say, children are the leaders of tomorrow. House officers are the future of the health sector in Nigeria, literally. So if these people are leaving, who are the people that are going to take over in years to come? Nobody has interest in doing residency in this country any longer. And even the people that are doing at the moment, I'm sure 70% of them, if you give them the opportunity, maybe they're able to get the money or whatever, people will leave. Because we have seen people that are senior registrars relocate. They will even relocate and start as medical officers. That's a lower point of the profession entirely. They don't mind. They just want to get out of this country and the insanity that is involved in the healthcare profession here. And the ungrateful people that, some people, not everybody, some people are really one of a kind. Everybody just wants to go. We need to just look into this situation honestly, because I have a feeling that time is coming when there is going to be a gap, a very huge gap in the profession. You will only see the really old people that will be there, and perhaps they'll be training the ones in medical school. So those ones will come out from school, do house job for 1 year. If they wish to, they might just decide to serve. But the way it is now, some people don't even want to serve again. When it's time to serve, you just relocate to one country, do your masters, write the exam, and start practicing there. That's if at all they will serve. So the professors will just be training people. Nigeria is only, that's the only thing we are good at the moment. We are training doctors for other countries. So they will just train those people. They will come out, write exams, and move. Go for masters, and they will not come back again. And the situation is bad. So you see that there will be nobody that is graduating beyond that point of becoming medical doctors. Some people are already affected. There are some places that let me use anesthesia, because I think that they are the people that are suffering the chronic shortage. Like when I say that the people that are doing residency there at the moment, there are serious issues. Serious issues. Those ones are not around. So there is a gap. There is a serious gap. And if the people at the top are not willing to talk, one day it will affect everybody. There are some senior registrars in some centers that are doing sleeping calls, so you have to stay in the hospital. That is something that before now, once you pass beyond the level of being a registrar, which is like the entry point of residency, to become a consultant, to become a specialist, for lack of a better word that you may understand. That's the entry point. When you pass that stage, you're moving over to the next. You don't have any business really staying in the hospital, just for you to come and review. The registrar will take emergencies with the help of the house officers, stabilize the patient. Then you come in and check. That's the way it's done here in Nigeria. But the way the situation is now, because of that chronic shortage, even people that have come to that point have to stay in the hospital. And before you know it, even consultants may have to start staying with us in the call room, because there's a shortage. And somebody has to get the work done, because we are talking about lives here. There's a serious shortage, and it has to be looked into. There's already that gap. The gap is already in some fields. The gap is already there. We don't really have people that are doing residency. The situation is so bad at the moment that it's almost as if they are begging people to come out. Not almost as if, it is as if. Because before now, for you to go into the residency program in Nigeria, you're expected to have written primaries. But now we'll see some hospitals advertising for people to come and do residency, and they'll say whether you have primaries or you don't have, please come, because the work has to get done. And like I said, I don't think it's getting any better. You know, some of you in some centers in Nigeria now, for you to see a doctor in a teaching hospital, a federal medical center, whatever, you have to come to the hospital by 6 o'clock and then get number. By that 6 o'clock, you may be the number 120-something patient. And by 1 o'clock, you have not seen the doctor. You know what I want to tell you? The way things are going, it is only going to get worse. It's not going to get better. No, I did not come here to lie to you. I'm just telling you the truth. It is only going to get worse. because we'll have fewer hands. People are going. People are going. So you have lesser number of people to see you in the hospital. Anyway, I don't even want to talk beyond this point again. I'll just add one or two things at the end. But pray for the healthcare sector in Nigeria and try to take care of yourself. Take preventive medicine serious. Eat right. Do exercise. If you have a doctor friend, treat them well. Hold them tight. Because time is coming, oh. Time is coming. If you know how many spaces, I won't speak beyond this point, but I hope that you understand to an extent how bad the situation is.